We are often asked in the treatment of men with non-obstructive azoospermia, which sperm are good enough to use? So it turns out that when sperm are taken from the testicle, 0%, none of those sperm will have normal morphology, meaning the shape that we would expect in ejaculated sperm, in part because sperm are reshaped after they leave the testicle and as they go through the epididymis before they're ejaculated. And the characteristics of morphology are determined based on ejaculated sperm. So how abnormal appearing a sperm can you use? Well, it turns out in a recent study of 198 couples where we retrieved sperm from men with non-obstructive azoospermia, meaning severely abnormal sperm production, the appearance of the sperm really had very little to do with how well those sperm worked. Again, no abnormality of the sperm precluded the chance of a pregnancy occurring. Now, overall, the fertilization rate using testicular sperm was lower than what we usually see in ICSI. It was only a 44% fertilization rate per injected sperm. And the sperm appearance at the time of retrieval had very little to do with what sperm looked like at the time of actual injection. So for example, over 90% of men have sperm with no motility at the time of retrieval, but well over 90% will have motility at the time of injection, either intrinsically, seen as twitching motility, or motility that can be induced with pentoxyfilline in the laboratory. Having severely abnormal acrosome morphology and having no motility was associated with lower pregnancy rates, but even using just non-motile sperm still had a pregnancy rate of 19%. For men with motile sperm at the time of injection, the pregnancy rate was 44%. An overall pregnancy rate of 38%. So there is no abnormality of sperm seen morphologically that precludes the chance of pregnancy using sperm from men with non-obstructive azoospermia. We're often told by IVF laboratories that sperm are not good enough to use. Our data suggest that's probably not true. The risk of birth defects we've seen is no different from what we see in a normal population or the general population as a whole. So remember, using testicular sperm from men with non-obstructive azoospermia is possible, even if those sperm appear abnormal. The link to our article is attached at the end of this video.